Now, sleep disorders. What is ascending reticular activating system? ARAS is ascending reticular activating system. It is responsible for wakefulness because of its afferent and efferent connections with the cerebral cortex. Now, inhibition of ARAS or inhibition of ascending reticular activating system. So, inhibition of this ascending reticular activating system induces sleep. So, when ARAS is inhibited or inhibition of ARAS, it results or it induces sleep. So, any lesion of ARAS leads to permanent somnolence, that is coma. And number one, coming to the sleep disorders, number one, what is insomnia? Insomnia is inability to sleep. Inability to sleep or abnormal wakefulness. It occurs due to systemic illness or mental conditions as psychiatric problems or alcohol addictions or drug addictions. Coming to the next one, hypersomnia. So what is hypersomnia? Is excess sleep, and it is due to lesion in the floor of the third ventricle, and it is due to brain tumors, encephalitis, chronic bronchitis, or diseases of muscles, or any endocrine disorders as myxedema or diabetes insipidus, etc. The next one will be narcolepsy. Narcolepsy is sudden attack of uncontrollable sleep. And what is cataplexy? Cataplexy is outburst of emotion. So both narcolepsy and cataplexy, they both are hypothalamic disorders. And next one will be the sleep apnea syndrome. What is sleep apnea syndrome? Sleep apnea syndrome is temporary stoppage of breathing repeatedly during sleep. And sleep apnea syndrome is the disorder that involves fluctuations in the rate and force of respiration during REM sleep with a short apneic episode. So apnea, it is due to decreased stimulation of respiratory centers and arrest of diaphragmatic movements and airway obstruction. So when breathing stops, the resultant hypercapnia and hypoxia stimulates respiration. Sleep apnea syndrome occurs in obesity, myxedema, and enlargement of tonsil and any lesion in the brainstem. And symptoms will be snoring, restless movements, nocturnal insomnia, and morning headache and fatigue. If severe, then results in hypertension or right heart failure, and stroke can also occur.